Hello, and welcome to this vital discussion on heart health specifically tailored for seniors. If you're over the age of 60 or you have loved ones in that age group, this video is for you. Heart health becomes increasingly important as we age, and today, we'll dive into what every senior should know to keep their heart strong, healthy, and resilient. Did you know that heart disease is one of the leading causes of death globally, and seniors are among the most affected? But here's the good news: by understanding how aging affects the heart and making some key lifestyle changes, you can significantly reduce your risk of heart-related problems. It's never too late to take charge of your heart health, and in this video, we'll cover everything you need to know, from the changes your heart undergoes as you age to practical steps to keep it in top shape. As we age, our bodies go through many changes, and our hearts are no exception. Understanding these changes is the first step in staying proactive about your health. So, let's start with the basics. What happens to the heart as we grow older? The heart is a powerful muscle, tirelessly pumping blood throughout your body, supplying oxygen and nutrients to every cell. Over time, however, it works harder to do the same job. For example, the walls of your heart may thicken slightly. This is a natural response to years of continuous pumping, but it can make your heart less efficient over time. The heart may also take a little longer to recover after exercise or exertion, meaning you might feel out of breath or fatigued more quickly than you used to. Another common change is the stiffening of arteries and blood vessels. Think of your arteries as flexible pipes that transport blood throughout your body. When you're younger, they expand and contract easily, helping maintain steady blood flow. But with age, these pipes can become less elastic, leading to increased blood pressure. High blood pressure, also known as hypertension, is a major risk factor for heart disease, and it's especially common in seniors. Additionally, the electrical system of your heart, which controls your heartbeat, may become less reliable with age. This can lead to irregular heart rhythms, also known as arrhythmias. Some of these changes are completely normal and harmless, but others can increase your risk of heart disease. Now that we've discussed the changes the heart goes through with age, let's take a closer look at some of the most common heart health issues that seniors face. Being aware of these conditions is crucial because early detection and management can make a huge difference. First on the list is coronary artery disease. This occurs when the arteries that supply blood to your heart become narrowed or blocked due to the buildup of cholesterol and plaque. Over time, this can reduce blood flow and lead to chest pain, shortness of breath, or even a heart attack. Next, we have heart failure. Despite its name, heart failure doesn't mean your heart stops working altogether. It means your heart isn't pumping blood as effectively as it should, which can lead to symptoms like fatigue, swelling in the legs, and difficulty breathing. Hypertension, or high blood pressure, as we mentioned earlier, is another major concern. It's often called the silent killer because it doesn't usually cause noticeable symptoms until it's done significant damage to your heart and arteries. If left untreated, it can lead to serious complications like heart attacks, strokes, and kidney damage. Atrial fibrillation, or AFib, is an irregular and often rapid heart rhythm that becomes more common as we age. It might feel like your heart is racing or fluttering, and it increases the risk of stroke if left unmanaged. Finally, let's not forget about heart valve disease, which occurs when one or more of the valves in your heart doesn't work properly. This can cause blood to flow backward or not flow efficiently, leading to fatigue, shortness of breath, and other symptoms. The good news is that while these conditions are common, they're also manageable, especially if detected early. Regular checkups with your doctor can help identify these issues before they become severe. Now, let's talk about the warning signs you should never ignore. One of the challenges with heart health is that symptoms can sometimes be subtle or mistaken for something else, like normal aging or fatigue. But knowing what to look out for can make all the difference. The most common warning sign is chest pain or discomfort. This could feel like pressure, squeezing, or a heaviness in your chest, and it's often a sign that your heart isn't getting enough oxygen. If you ever experience severe chest pain that lasts more than a few minutes or spreads to your arms, neck, jaw, or back, it's essential to seek medical attention immediately. This could be a heart attack. Shortness of breath is another symptom that shouldn't be ignored. it's normal to feel a bit winded after climbing stairs or exercising, but if you find yourself struggling to breathe during routine activities or while resting, it could indicate a problem with your heart or lungs. Pay attention to signs of fatigue, especially if it's sudden or severe. Feeling unusually tired after mild exertion or throughout the day could signal that your heart isn't pumping blood efficiently. Swelling in the legs, ankles, or feet is another red flag. This is often a sign of fluid buildup, which can occur when your heart isn't functioning properly. You might also notice weight gain from fluid retention. Dizziness, lightheadedness, or fainting spells can be linked to irregular heart rhythms or low blood pressure. If these symptoms occur frequently, it's important to consult your doctor. Irregular heartbeats or palpitations might feel like your heart is racing, skipping beats, or fluttering. While occasional palpitations can be harmless, persistent or severe episodes should be evaluated by a healthcare professional. The key takeaway here is simple: don't ignore these symptoms or brush them off as just part of getting older. If something feels off, it's always better to err on the side of caution and consult your doctor. We've covered a lot of important information so far, from how aging affects your heart to common heart conditions and warning signs to watch for. But this is just the beginning. In the next part, we'll dive into actionable steps you can take to maintain a healthy heart, including diet, exercise, stress management, and key questions to ask your doctor. Remember, your heart works hard for you every single day. It deserves your care and attention. Small changes in your lifestyle can lead to big improvements in your heart health, no matter your age. So stay tuned for the next part, where we'll explore how to keep your heart strong and healthy for years to come. The food you eat plays a significant role in the health of your heart. Think of it this way: your diet is the fuel that powers your body, and choosing the right fuel can help your heart perform at its best. So, what does a heart-healthy diet look like? First and foremost, focus on whole, unprocessed foods. Fresh fruits and vegetables should be the cornerstone of your meals. They're rich in vitamins, minerals, and antioxidants that protect your heart from damage and reduce inflammation. Leafy greens like spinach, kale, and broccoli are particularly beneficial, as are colorful vegetables like bell peppers, carrots, and tomatoes. Next, let's talk about whole grains. Foods like oats, brown rice, quinoa, and whole grain bread are excellent sources of fiber, which helps lower cholesterol levels and keeps your arteries clear. The fiber in these foods also promotes healthy digestion and keeps your blood sugar levels stable. When it comes to protein, choose lean sources such as fish, skinless poultry, beans, and lentils. Fatty fish like salmon, mackerel, and sardines are especially heart-healthy because they're rich in omega-3 fatty acids, which reduce inflammation and lower your risk of heart disease. Healthy fats are another essential part of a heart-friendly diet. You'll find these in foods like avocados, nuts, seeds, and olive oil. These fats are much better for your heart than the saturated and trans fats found in processed and fried foods. Speaking of fats, it's important to limit your intake of red meat and full-fat dairy products, as these can raise your cholesterol levels. And let's not forget about hydration. Drinking plenty of water helps your heart pump blood more efficiently and keeps your entire body functioning smoothly. Try to avoid sugary drinks like soda and limit your alcohol intake, as these can negatively affect your heart health. Finally, watch your salt intake. Too much sodium can raise your blood pressure, which puts extra strain on your heart. Instead of adding salt to your meals, experiment with herbs and spices to enhance the flavor of your food. Physical activity is one of the best things you can do for your heart. Regular exercise strengthens your heart muscle, improves blood circulation, and helps you maintain a healthy weight, all of which reduce your risk of heart disease. If you're not currently active, don't worry. You don't need to run marathons or spend hours at the gym to benefit from exercise. Even small amounts of activity can make a big difference. Start with something simple, like walking. A brisk 30-minute walk most days of the week can lower your blood pressure, improve your cholesterol levels, and boost your mood. Other great options include swimming, cycling, and dancing. These activities are not only good for your heart, but they're also enjoyable and can be done at your own pace. Strength training, such as lifting light weights or using resistance bands, is another excellent way to support your heart health. It helps maintain muscle mass and improves your overall endurance. If you have joint issues or limited mobility, consider low-impact exercises like yoga or tai chi. These practices not only enhance your physical health, but also promote relaxation and reduce stress, which is another key factor in heart health. Remember, consistency is more important than intensity. Aim for at least 150 minutes of moderate aerobic activity per week, and don't forget to include some form of strength training at least twice a week. Stress is a part of life, but chronic stress can take a toll on your heart. When you're stressed, your body releases hormones like adrenaline and cortisol, which can raise your blood pressure and increase your heart rate. Over time, this can lead to serious heart problems. The good news is that there are many ways to manage stress and protect your heart. Mindfulness meditation is a powerful tool that can help you stay calm and centered. Just 10 minutes of meditation a day can lower your stress levels and improve your overall well-being. Deep breathing exercises are another effective way to reduce stress. When you feel overwhelmed, take a few minutes to focus on your breathing. Inhale deeply through your nose, hold for a moment, and exhale slowly through your mouth. This simple practice can help lower your heart rate and calm your mind. Physical activity, as we mentioned earlier, is also a great stress reliever. Whether it's a walk in the park, a yoga session, or a bike ride, moving your body helps release tension and boosts your mood. Don't underestimate the power of social connections either. Spending time with friends and family, talking to a loved one, or even joining a community group can help you feel supported and reduce stress. Finally, make time for activities you enjoy. Whether it's reading, gardening, painting, or playing a musical instrument, doing things that bring you joy can be a wonderful way to unwind and recharge. Taking care of your heart isn't something you have to do alone. Regular checkups with your doctor are essential for monitoring your heart health and catching potential problems early. During your visits, be proactive about asking questions. For example, you might ask, "What's my blood pressure and cholesterol level, and are they within a healthy range, or do I need any additional tests to assess my heart health?" Your doctor can also help you understand your risk factors for heart disease and recommend steps to reduce them. If you're taking medications for your heart or any other condition, make sure you understand how to take them properly. Ask your doctor or pharmacist about potential side effects, interactions with other medications, and whether there are any foods or activities you should avoid. It's also important to be honest with your doctor about any symptoms you're experiencing, even if they seem minor. Whether it's occasional chest discomfort, shortness of breath, or fatigue, sharing this information can help your doctor provide the best care possible. Maintaining heart health as a senior may seem challenging, but it's entirely within your reach. By focusing on a nutritious diet, staying physically active, managing stress, and maintaining regular communication with your doctor, you can keep your heart strong and healthy for years to come. Remember, it's never too late to make positive changes. Start small, be consistent, and celebrate your progress along the way. Your heart works hard for you every single day. Let's work just as hard to take care of it. Thank you for watching, and if you found this information helpful, don't forget to share it with others who might benefit. Together, we can spread awareness and help more seniors take charge of their heart health. Stay healthy, stay happy, and take care.